The human body is a complex and intricate system, a city of interconnected parts, each with a specific and vital role. Deep within this system, in a protective pouch of skin called the scrotum, lie the testicles. These two small, oval-shaped organs are the primary factories of male life. Think of them as busy workshops, constantly working. Their location outside the main body cavity is not an accident, it is a clever design. This placement keeps them slightly cooler than the rest of the body, creating the perfect temperature needed for them to perform their essential duties without interruption or error, a delicate balance maintained for a critical purpose. One of the main jobs of these factories is to produce sperm. Sperm are the tiny cells necessary for creating new life. Millions are made every single day in a continuous microscopic ballet of creation. But the testicles have another equally important function. They are also responsible for producing testosterone. This is the main male hormone, a chemical messenger that travels throughout the body. It is the architect of the male form, responsible for the deeper voice, the growth of facial and body hair, and the development of muscle mass. It is a powerful substance that shapes a man's physical identity from puberty onwards. The work of the testicles is therefore twofold, a dual mandate of profound significance. They are at once the source of future generations and the wellspring of male characteristics. This dual role makes them fundamentally important to the body's overall health and function. They are not isolated islands but are deeply connected to the endocrine and reproductive systems, influencing everything from mood to bone density. Understanding their purpose is the first step in appreciating their health and recognizing when something might be amiss in these crucial, hard-working factories of the body. Without the proper function of these organs, the delicate hormonal balance of the body can be disrupted, and the ability to reproduce can be lost. They are sensitive yet resilient, carrying out their silent, ceaseless work throughout a man's life. It is because of this constant activity and their vital importance that we must pay close attention to them. They are a cornerstone of male biology, and their well-being is directly tied to the well-being of the entire person. Protecting them means protecting a fundamental part of one's own health and future. Our bodies are made of trillions of cells. These cells normally grow and divide in a very orderly and controlled way. They know when to grow, when to stop growing, and when to die. This is the natural, healthy cycle of life within us. Cancer, in its simplest form, is what happens when this orderly process breaks down. It is a rebellion. A small group of cells begins to ignore the body's rules. They start to grow and divide without any control, refusing to stop. They become outlaws, creating a mass or lump called a tumor, a colony of defiant cells. Testicular cancer is this very rebellion, but one that begins inside a testicle. It starts when the cells that are supposed to become mature sperm, the germ cells, mutate and grow uncontrollably. For reasons we are still working to fully understand, these cells forget their original purpose. Instead of following their programming, they embark on a path of relentless multiplication. This abnormal growth forms a tumor, which can often be felt as a painless lump or swelling in the testicle. It is a localized insurrection that, if left unchecked, can threaten the entire system. This type of cancer is unique for several reasons. One of the most notable is that it tends to affect younger men. While many cancers are more common in older individuals, testicular cancer most often appears in men between the ages of 15 and 35. This is a time of life typically associated with peak health and vitality, which makes its appearance all the more unexpected and concerning. It is a disease of youth and early adulthood, a stark reminder that cancer does not always wait for old age to strike. Its presence is a disruption of the natural order. It is important to know that almost all testicular cancers begin in the germ cells. Because these are the foundational cells for reproduction, their mutation is a profound deviation from their biological destiny. The tumor they form can grow, and if not treated, can eventually spread beyond the testicle. It can travel through the body's highways, the blood vessels and lymph channels, to other organs like the lungs, liver, or brain. This spread, known as metastasis, is what makes any cancer so dangerous. It is a local rebellion that threatens to become a widespread war. The body often sends signals when something is wrong. We must learn to listen. For testicular cancer, the signs can be subtle, but they are there. The most common sign is a lump or swelling in one of the testicles. Importantly, this lump is often painless. A man might also notice a feeling of heaviness, or a dull ache in the lower belly or scrotum. Sometimes one testicle may feel firmer than the other or change in size. Any change from what is normal for you is a signal that should not be ignored. It is your body's way of raising an alarm, asking for attention. Learning to perform a monthly testicular self-exam is one of the most powerful things a young man can do for his health. The best time to do this is during or after a warm bath or shower, when the skin of the scrotum is relaxed. The process is simple. You should check one testicle at a time. Hold the testicle between your thumbs and fingers of both hands and roll it gently. You are feeling for any hard lumps, smooth rounded bumps, or any change in the size, shape, or consistency of the testicle. It is a moment of personal inventory, a quiet check-in with your own body. It is normal for one testicle to be slightly larger than the other, and it's also normal to feel a soft, ropey structure on the back of each testicle. This is the epididymis, which stores and carries sperm. Knowing what feels normal is the key. By checking yourself regularly, you become familiar with your own body's landscape. This familiarity makes it much easier to spot a newcomer, a lump or change that wasn't there before. The goal is not to become anxious, but to become aware. It's an act of self-knowledge and self-care that takes only a minute. If you find anything unusual during a self-exam, a lump, a swelling, or any other change, the next step is critical. You must talk to a doctor. It's natural to feel worried or even scared, but remember that many lumps are not cancer. There are other conditions that can cause similar symptoms. However, only a doctor can determine the cause. Delaying a visit out of fear or embarrassment can have serious consequences. An early conversation with a healthcare professional is the bridge between detection and a solution, a vital step toward peace of mind and health. When you see a doctor about a concern, they will begin a careful process of investigation. The diagnosis of testicular cancer usually starts with a physical exam. The doctor will feel the testicles for any lumps or abnormalities. If they suspect something, the next step is often an ultrasound. This is a painless imaging test that uses sound waves to create a picture of the inside of your scrotum. It can clearly show if a lump is solid, which might be cancer, or if it is filled with fluid, which is likely a harmless cyst. Blood tests may also be done to look for specific proteins, called tumor markers. If the tests point strongly toward cancer, the standard and most effective treatment is a surgery called a radical inguinal orchiectomy. This involves removing the entire affected testicle through a small incision in the groin. While the idea of this surgery can be frightening, it is a remarkably successful procedure. For most men with early-stage cancer, this surgery alone is enough to cure them completely. The remaining testicle will continue to produce enough testosterone and sperm, so a man's ability to have children and his physical characteristics are usually not affected. It is a decisive action to remove the source of the rebellion. For cancers that may have spread or are at a higher risk of coming back, further treatment might be needed after surgery. This can include chemotherapy, which uses powerful medicines to kill cancer cells throughout the body, or radiation therapy, which uses high-energy rays to target specific areas. These treatments are highly effective against testicular cancer. In fact, this particular cancer is one of the most curable forms of cancer that exists today. The prognosis, or outlook, for men diagnosed with testicular cancer is overwhelmingly positive, especially when it is found early. The story of testicular cancer is ultimately a story of hope. Advances in medicine have transformed it from a once-feared diagnosis into a highly treatable condition. The key to this success story is awareness and action. Do not be afraid of what you might find. Be empowered by the knowledge that you can take control of your health. Perform regular self-checks. Listen to your body. And if you notice anything that concerns you, speak to a doctor without delay. It is a simple, brave act that can secure a long and healthy future. Your health is in your hands.